Okay, I guess we can go ahead and get started. I know some people are still joining, but I think we'll go ahead and start. Hello, hello, and welcome everyone. I'm so excited to have all of you here today for our Language Lived series. This is the first one we've ever had in ASL, and so I'm so excited about it. So, lived language, what is that? So, really, it's a series. We have five different languages that we do immersions in. And so far, we take turns showing their journey, showing the coaches' journeys and their experience with their culture, their language, and everything related. And so, really, we're honestly just so happy and we cherish the lived language series and especially this ASL series. So, Conversifi is the agency that we do. This is the sign for it, Conversifi. And what we are is an online platform, and we connect language learners that, are native speakers with people who are interesting in learning. And we have coaches that support you through your learning experience and help you become fully immersed within the culture and the community and learn skills to be able to communicate in sign language. I know some of you joined and I wasn't able to see exactly where all of you from. So where are you all coming in from today? Florida. Oh, wow. This is all over. Oh, cool. That's awesome. Well, I'm thrilled that everyone is here enjoying tonight. So I am honored to be able to present our guest, Natabi. Natabi is great. We've known each other for a long time. I want to say since 2021. We met over at Gallaudet University where we went to school together and we both became coaches. Natabi is near and dear to my heart. And so today's topic is healthcare. It's related to healthcare within the deaf community and what are the needs within healthcare and what kind of accommodations we need, what kind of, accessibility tools are there for us, and how can we take care of ourselves and our lives? Because if we can't have a healthy life, then we can't do anything. So, Intabi will be here to discuss her experience and her journey with her life and her own work experience that she's had. And I'll go ahead and give the stage to Natabi. Natabi. Hi, everyone. Can everyone see me okay? If you can, please give me a react, a thumbs up, or something, just so I can make sure everyone can see me clearly. All right, looks like everyone sees me well. That's awesome. Okay, and if you don't mind to go ahead and share the screen. Okay, well, thank you, Ia. Hello, everyone. So I'm wanting to say first, happy National ASL Day. I know we're a day late, but still happy ASL Day. My name is Nthabeleng. My last name is MacDonald. I go by Ntabi, and this is my sign name. My pronouns are she and her, and I'm one of the ASL coaches here at Conversifi. I'm excited to have all of you join me as I share about my lived language experiences as a Black deaf woman in healthcare. Okay, so I wanted to go ahead and share a little bit about myself before we dive into this theme for today and this topic. I went to Gallaudet University and I graduated with my BA in psychology with a concentration on pre-health studies in 2023. I was born in Petersburg, South Africa, but I did grow up here in the US and I've been here in Maryland for almost about 3 years now. In the near future, I plan to get a master's degree of public health, an MPH, because I am passionate about several areas of the public health, such as patient care, health equity, patient safety, and hospital quality experience. I hope to leverage my degree into leadership roles and shape my future clinical role and start my career in medicine where I can support the patients and ensure their quality of care is accessible, advocated, and high quality, regardless of their background. I'm currently a certified medical assistant seeking hands-on experience across the different medical fields. And so, like I said again, I'm a certified CMA and I'm seeking hands-on clinical experience across different medical specialties. So I want to take the opportunity to share a couple of signs with you. The first one I'm going to teach you is patient care, and the sign is this. It's and that's patient care. And then we have health equity, and this is the sign for that. So those are the first two signs that I'm going to give you throughout this presentation, and you can try to keep those in mind and practice them while we're getting through this. So now I want to give a little bit of background about National ASL Day. Next slide, please. So like I mentioned, National ASL Day is a celebration on April 15th every year. Before I dive into my lived language journey, I want to talk just a little bit about the history of ASL and our deaf culture. American Sign Language is a visual language that uses forms of hand shapes, movements, and facial expressions. American Sign Language's grammar is structured differently than English, and it's used primarily by individuals who are deaf, hard of hearing, with or without disabilities, and also children and siblings of deaf adults, which the acronyms for those are CODAs and SODAs. And also some hearing people use sign language. You may have seen the ASL alphabet at your workplace, maybe school, or even in a good old-fashioned sign language handbook. If you have seen the alphabet somewhere in sign language, go ahead and give me a thumbs up so I can see how many people are at least somewhat familiar with it. Awesome. Wow, it seems like many of you are familiar with the ABCs. So now we're going to give two more signs to teach you. The first one is hand shape, and the second one is facial expressions. And so, that kind of just shows the movement on the face. So something just to keep in mind. Next slide, please. So, like I said, National ASL Day is celebrated on April 15th, marking the opening of the first deaf school called the American School for the Deaf in 1817. ASL was not invented by one single person. However, Laurent Clerc, this is a sign name, and Thomas Hopkins Gallaudet, this is his sign name, played a key role in the development through French Sign Language and founding of the first deaf school. I want to briefly explain about their sign names given to both Clerc and Gallaudet and the general rules. So their sign names were given to them by the community, the deaf community. And one important rule that you have to remember is that a deaf person should always give you a sign name. And that's because we are giving whatever you get your own sign name, it carries its own meaning and it has its own qualities related to your personality, tendencies, or interest. And it's considered a special gift from the ASL community, the deaf community to be exact, because it's in ASL rather than spoken, almost like a nickname. So I remember the sign clerk and Gallaudet. I'm not sure exactly where or how they got their sign name for clerk, but however, Gallaudet, he got his sign name because he was the one who also played a key role in the development of the University Gallaudet. And there's a symbol on the sign that looks kind of like a curved shape. And so people gave him the name Gallaudet, symboling the school Gallaudet University. So why is ASL so important? Well, really, it provides history, a rich history, culture, values, and identity. It also fosters inclusion and sense of belonging within the deaf, hard of hearing, and deaf plus communities. And it also provides full access to communication, allowing full participation in society. And also, ASL is a visual language, which means anyone can learn it. That's pretty cool. So now that we've learned a little bit about our language, a little history, we'll now talk about my background and my journey as a member of the deaf community. So you may be wondering, am I deaf, hard of hearing, or even hearing? I am deaf. I have what's called sensorineural neural hearing loss, the acronym SNHL, with an unknown cause. I'm profoundly deaf in my right ear. I lost hearing before the age of 1. We don't know the exact month I was whenever it happened, but it was before I turned 1. My family and I didn't have the resources that we needed for connections to understand my hearing loss in South Africa, so we moved here to the US in 2004. I started learning sign language at the age of 4, so I was fairly oral, meaning I learned to speak, but both English and ASL are my primary languages. I attended mainstream school from preschool to 4th grade. And during that time, I went through countless speech therapy sessions, oralism, and simultaneously used spoken English and signed exact English, which the acronym for that is SEE, to communicate. And I also identify as hard of hearing because I could speak and I also wore hearing aids with the ability to hear a significant amount. In 5th grade, I graduated and I went to my first boarding school in Ohio. And the experience was so eye-opening. I actually went through a culture shock, and that was because I had never gone to a school for the deaf before. In my previous school, I had like just a few classes that I shared with 2, maybe 3 other deaf hard of hearing students, and it was led by a deaf teacher. So during my time there, I learned so much about deaf culture, and learn not and learn only with the deaf and hard of hearing counterparts. I still identified as hard of hearing. I eventually attended 2 more boarding schools for the deaf until I graduated high school. I went to Gallaudet for my undergrad, like I previously mentioned, and there I discovered the use of my 2 identities. And really, it depended on the situation as far as if I identified as deaf or hard of hearing. Sometimes I identify as deaf when I'm with my deaf and hard of hearing friends or in a classroom. However, if I'm out in the hearing world with my hearing friends, I identify myself as hard of hearing. So now we're going to talk a little bit about my interest in the medical field and what really inspired me to become a PA. So my passion for medicine and healthcare originally stemmed from my personal lived experiences whenever I was a child. I had a friend who faced repeatedly misdiagnoses due to poor clinician patient communication. Though her story is really complex, it inspired me to want to create a change within the healthcare system to help bridge the gaps and health disparities. Her health journey also sparked my curiosity on how medical conditions can affect individuals' mentality, physical, and emotional well-being. I have a strong passion for working with children, which has guided my desire to pursue a specialty focused on child and adolescent health and improving their overall quality of life. My interests in medicine have further expanded through my involvement in health equity research and exposure to patient safety issues within hospital settings. And I also really like the PA field because it offers a lateral mobility between different specialties and also emphasizes teamwork and collaboration in patient care. I have more reason behind wanting to pursue this field instead of the MD route, but we could get into that another time. So in early 2022, I still knew I wanted to pursue medicine, but I needed something to confirm my interest. And so I got some shadowing experience and I began to search for opportunities. And I was accepted into a highly competitive fellowship program abroad, actually. And I also had a keen interest in traveling. So I saw the fellowship as my chance to explore medicine and travel at the same time, which was the perfect opportunity for me. So during my experience, I had the opportunity to learn about many specialties, hands-on workshops. I observed surgeries in the operating room. I met patients with various medical conditions, and I was able to connect with doctors from all walks of life, especially those working in the Italian healthcare system. One of the cool experiences I had was observing a physician patient interaction where most of them spoke only Italian, even though my interpreter, it was pretty cool, even though my interpreter and I couldn't understand them. But luckily, there was another physician there who spoke English, and they were able to translate for us during the conversations. Really, overall, it was a once in a lifetime opportunity that I'm very grateful for. And really, it further solidified my passion for medicine. And I also want to share how I navigated through this experience with accessibility and what that looked like for me. During my time in Italy, I had to learn how to adjust to a new country, new language, new people, accents, and cultural differences. So, a mentor of mine actually gave me Italian language books, but honestly, I did not depend on that heavily and use them. I really heavily relied on Google Translate, gestures, and communicating through my interpreters, and also or communicating with my interpreters with the Italians I met on this trip. I hired two highly skilled ASL interpreters who had extensive medical backgrounds, and I couldn't have navigated this experience without them. They really exceeded my expectations, especially with their background in medicine. So I will always give thanks to them. So now for the next slide. So the first word is surgery. And so you do your palm with the thumb going down it. Then we have the word specialty, like a specialty in cardiology. or a specialty in ENT or neurology, for example. So that's what specialty means. And then we have the sign for accessibility. And this is the sign for accessibility. So the accessibility to communicate, accessibility for wheelchairs, things like that. So really my work is rooted for making sure patients with disabilities and language barriers have access to communication and equitable care to prevent adverse outcomes. So what are some of the barriers we face as deaf people in healthcare? So I'll touch on just a few. One is ASL interpreters. We have a hard time finding highly qualified interpreters in hospitals. There's not enough out in the field that are qualified. And so that's one barrier. Another is sometimes a office may refuse to have an interpreter. By law, they're supposed to, but unfortunately, sometimes they don't follow that and they refuse to hire an interpreter. And we also have a high demand for medical interpreters. It's really important to us because the interpreter has to have knowledge in that field of medicine, and it's important that they're able to communicate effectively with ASL to the patient to help the patient understand exactly what is going on as far as their medical needs. And in medical system, like in the medical world, there's a lot of big terminology, so it's important that the interpreter is well knowledgeable on that. And the third thing, maybe you've seen it before, maybe not, but it's called VRI, and that means video remote interpreting. And so, for example, if you go to a doctor's appointment, there's an iPad on like on some wheels. It's not in person, but the interpreter pops up on the screen. They can see you, you can see them. Most people, including myself, don't prefer that method because, the problems we have with technology, the inconsistency in like networks and freezing, so communication can become an issue with that. And honestly, sometimes hospitals may not even provide that. But those are some of the key barriers that we have faced in the deaf community. And if you're interested in learning more, feel free to contact me or ask me questions and we could talk at the end. So now I want to share my own personal experience with my personal experiences in healthcare. So the first one, I remember that I went to volunteer at Children's National in DC, and I was told that there were a few deaf, hard of hearing patients, and I was thrilled. I was like, oh my gosh, like, yes, I get to communicate in my language, I get to advocate and support. And so I remember the interaction that I had with this one patient. And unfortunately, I saw that there was a lot of communication issues. I seen the patient trying to communicate to the doctor. However, the doctor would not accommodate their needs and would not provide an interpreter. And whenever a deaf person is in the hospital, there's typically a sign outside of the door notifying the medical team that they have an ASL interpreter and to proceed in that order. And so, whenever you don't have an interpreter, it can cause negative outcomes for the patient. And so, luckily, in this situation where there was no communication, I was able to step in and tell the doctor that it wasn't okay and to remind them that they have to be able to communicate either VRI or rely on an interpreter. And, these are problems that we still are faced with today. And so I want to talk about my professional experiences with medical assistants and relying on interpreters to communicate with my coworkers. Unfortunately, there are no interpreters that I have. In a perfect world, I could have a 9 to 5 interpreter there shadowing me, and I could call them anytime that I needed that and they were in the building, but that's impossible. Really, I rely heavily on lip reading, which is not common in the deaf community. I write back and forth. I use Google Chat. And sometimes I have to remind my coworkers that eye contact is very important because if you're not looking at me and your face is turned, it's very hard for me to understand what's being said. So that's one challenge that I've experienced personally. So with all these things that are happening and all these barriers, what can we do to address this situation? What can we do to address the issue at hand? And honestly, the answer is not clear cut. However, it's important to raise awareness and educate ourselves about health barriers we face in the deaf, hard of hearing and with deaf, hard of hearing patients, employees, and individuals who do experience language barriers and how these barriers can impact health outcomes. And while we do have the ADA laws in place to protect us, they're not always enforced and may only apply to certain areas or groups of Americans with disabilities. There's still a lot of work that does need to be done. So I want to talk a little bit more about what should be the r- realistic expectation for accessibility. Should we have interpreters on call 9 to 5 ready to go to help with communication? I mean, that's a dream, but sometimes we don't have that ability, and we do want to help reduce communication barriers. And so, one thing that we can do is use clear mask instead of the regular mask that are solid and it hides the lips. So one thing that does really help is to be able to have a clear mask so a deaf, hard of hearing person can see what's being said. For some deaf, hard of hearing individuals like myself, I can make calls, but I do have to use live captions, and that helps me. So more access to captions. And also we have many apps that are available to be used that really help with conversations. For example, Cal Telephone, Google Live Captions, Inno Captions, and things like that. So I want to talk about my professional journey in advocacy for deaf, hard of hearing individuals. So, for example, one of my work experiences that I'm involved with is providing consultations for language specialties, providing helping interpreters improve their skills basically and help them to become more knowledgeable on healthcare interpreting, understanding the medical terminology, concepts, and how to effectively translate them into ASL. And so I've been involved with that for about 3 years, and it's really important work that I do. And it really, since then, we've had a small group, but I'm really hoping to gain more interpreters into the group. Secondly, I've performed extensive research in several areas of deaf health equity in cancer health prevention and a combination of trauma-informed care as well as language deprivation to health prevention strategies for patients who want to access care. So I have a couple more signs to teach you. So we do have an old sign for cancer, but we don't use that anymore. We fingerspell cancer, health, prevention. Next is trauma-informed care. So trauma-informed care. I know maybe you're like, is there no sign? But sometimes you do have to fingerspell things and there's not a sign for them. I was just going to show you a little bit of some of my work and research that I've done. This is one of my favorite quotes because this applies completely to my work. I am for equity because equity starts with everyone. That's perfect. It couldn't be a better example of what I'm doing with my journey. All right, so I wanted to share a few more signs with all of you. The sign for injection. This is very visual, can't be very hard to forget. It literally looks like you're getting an injection. The next sign is blood, blood, as if it's trickling down. If someone asks you, how are you? This is a sign for how are you? Or you could say how with one twist, are you? Whatever you're most comfortable with. The sign for sick. And with this, you should use more facial expression to show how sick you are. The sign for hurt. You have three words that are in the same sign. You have hurt, pain, and injury. It's the same sign. It's just more of how you show it on your face. So if you're curious to know more medical signs, let me know. I would be happy to share with you, and you can contact me anytime. Next slide, please. Okay, so I did want to go ahead and spotlight several deaf, hard of hearing professionals. Some are doctors, some are PAs, medical students, and nurses who are fairly known in the deaf community. So like I said, some they have all have different types of roles, PAs, doctors, medical students, and they are known in the deaf community. And when I say fairly known, some of these individuals are well known in the deaf, hard of hearing, and fluent signing because they're deaf, hard of hearing, and fluent in signing. Some may be late deafened or hearing loss associated identities or newer to ASL. So it's quite a range. There are more that I could list, but they're not pictured here named. But there is still such a high demand for deaf, hard of hearing providers to care for deaf and hard of hearing patients across the nation and globally. We have a very small percentage of providers. And so I just wanted to spotlight them and give them their flowers and let you know that there are providers that are deaf, hard of hearing. Next slide, please. Okay, so now we're getting to the end of my presentation, but I did want to do a short, fun quiz to see what you learned through the presentation. You can go ahead and take your phone and scan the QR code, or you can click the link and pull it up on your web. Thank you all for your patience. So if you can, go ahead and scan the QR code and we'll make sure everyone is in the room. So in the chat, could you let me know when you're ready so I know how many people have joined? Oh, it's showing the answers. Hmm. Oh man. Okay. Lily, do you mind to stop sharing the screen? Let me figure out what is going on with the QR code. So I guess I could just either copy and paste the questions in the chat, or I could just sign them and you all can pop your answer in the chat. Oh gosh, I gave you the answer. Oh gosh, yeah. Okay. Hopefully some of you didn't see that. But if you already know, don't say anything. But yes, it is April 15th, 1817. I'm going to make sure that I remove correct from the next questions. Okay, let's try this again. So the second question, who can learn ASL? Is it one? Oh, yeah, beautiful. Yep, anyone can learn ASL. I see everyone is learning and they're engaged. And I noticed that some of you are some ASL students already. I encourage you to keep it up and you've got this. All right, next question. When did Nthabeleng learn how to use ASL? So, oh my goodness, I can't even finish signing it, and you all already know. Okay, you guys are paying attention. I see you're going to pass this quiz. Good job. Yes, I did learn ASL whenever I was 4. All right, the next question. I think the format is weird, is the reason why I'm having a hard time. Okay, so this is the next question. Yep, beautiful. You guys got all of the questions right. Good job. So now I have one more question, and I want you to think about it. I want you to think about one takeaway that changed your perspective today. I'll give you a few moments to think, and then you could type it in the chat. So the first one says the power health professionals. Oh gosh, they're coming so fast. The power health professionals take advantage of when they're trying to deny deaf patients adequate communication access. Yeah, I mean, yeah, that's a huge one. That's a huge barrier that we always face. Thanks for that. So I'm amazed. It's an eye opener that you don't have an interpreter on staff for communication access while you work. I know, right? Ashlyn said, didn't realize so many barriers in the deaf hard of hearing community. Yeah, I mean, we're always researching, always trying to, connect with the community outside of ours. And from my perspective and other people's perspective, you know, trying to get the barriers reduced is really important. So I just want to thank all of you for your responses, for your participation, and I really appreciate all of you joining tonight. All right, this is Lily speaking now. I want to say thank you all so much. That was a beautiful presentation in Tabi, and we learned so much. So if you have any questions that you wanted to ask, go ahead and type them in the chat, and we can do a question and answer period before we end the night. So one question that I seen, it said, how has your experience been with your amplification and audiologist? I have aspirations to be an audiologist and I want to be a supportive and potential deaf hard of hearing clients and possibly and knowing ASL. So this is Natabi speaking. Really the biggest thing is making sure you one, learn ASL, two, and understand what kind of client you're dealing with. Are they deaf? Are they latent deaf? Do they have a hearing loss? Are they hard of hearing? That's very important. And I say that because, for example, while I was at Gallaudet, Gallaudet has an audiologist program for those who are interested in becoming one. And they're very skilled with the curriculum, but I've met some students personally who have no idea about ASL and have no interest in learning ASL. And so that's just one interesting thought that I've had, especially knowing the importance of ASL and how to communicate with your patients with a hearing loss. And I know that some maybe don't want to learn ASL, but I think that it's important that you become more aware about our deaf culture and our language because some people, for example, those who are patients, have hearing loss, but some maybe express that they struggle with communicating. And I think that's important for us to have that knowledge and the resources to be able to connect them with the community if they don't have a community or know sign language. So I think something really important is just to always have access to those tools to provide for the deaf community or deaf patients. Another thing is unfortunate, but oftentimes children are born to hearing families and they just automatically give the option, oh, we're going to give you a cochlear or here's a hearing aid or, certain things, but they don't give them any information on deaf culture. And that's something that, we as a community face too. And so it's really important to be aware that there is a culture, that we have a culture, and it's a support system also. So another person asked, can you talk a little bit more about your experience in mainstream school and where you couldn't communicate the most with other kids? So I went to mainstream school from kindergarten to fifth grade. So are you curious to know what my classes look like? If that's the case, then I had two or three classes before I went to my deaf school, and we were all hard of hearing. I had just a few classmates. We had hearing aids, and we also had a deaf educator, but there was only one in the mainstream school. And my family was still learning more about my deafness and learning about deaf culture and hearing loss and everything that comes with that. And so, yes, I did face a lot of challenges communicating with peers and kids my age because they didn't understand my hearing loss. And sometimes I felt isolated and alone. And I'm really grateful for my deaf teacher that I had and also my two classmates because we support each other and we were just we were a team. So, yeah, that was a good question. Thank you. So I see many deaf people, you said they don't grow up in deaf schools. So if deaf, another question from Lily, if deaf people don't have good health care or support with doctors, what are common outcomes for that? So the first is misdiagnoses. So for example, if a patient has a medical condition like schizophrenia, the doctor may think they have bipolar disease instead. And so that means their treatment plan looks different. And with schizophrenia and bipolar, those treatment plans are different. So that is one bad outcome that could happen is getting placed on the wrong plan. And so that's something that we do experience. And it's really important to know that we need full access to communications. I'm sorry, to communications regarding our background and regarding the medicine that we've taken. So all of that is critical, but it's the key thing to prevent misdiagnoses from happening. So the next question says, how do future interpreters, give me one second. So how can future interpreters, especially Black interpreters, best support Black deaf mothers and parents in the field? The statistics around adverse outcomes for Black mothers are awful. Yeah, I agree. That's very great. That's a very great question. So I don't have all of the knowledge about Black interpreters and working with Black patients specifically, but I know one thing that you can do is to educate yourself. There's some organizations that specialize in Black communities with interpreters and everything like that. But I think it's important to do your research and learn more about the statistics and what are some things that you can do to take action. And that's something that I'm going to have as a takeaway tonight. I'm going to have to think about that. So, Lily is saying, with your experience growing up and not being able to hear while in the doctor's office, how does that impact your future for communicating with other patients? And Tavi says, can you say that again? Okay. Lily says, so growing up being deaf and working in the medical field, how does that impact your interaction with patients? So obviously, as a kid, I can't advocate for myself. So I think my experience with struggling to communicate with a doctor without an interpreter or accommodations has definitely made an impact on my passion to address health equity. and the issues that come up and the issues that are faced every day. I also went to Gallaudet for my studies, so I was involved in a lot of health research and so much about statistics and how accessibility and care is the main culprit for outcomes for health. And unfortunately, the outcomes of the statistics were the positive outcomes were really low. And so that's why I decided to go ahead and pursue my master's with a focus on health equity. And I also am interested to be in a program that I'm interested in setting up a program that has a network of interpreters ready to interpret and to help reduce those communication barriers. Lily said, so you mentioned in the beginning from whenever you were growing up in South Africa, right? Natabi says, yes, I was born there. Lily says, so communication there and here, is it different or is it same? So like for example, when you're traveling, is it fine and it's a cool experience? Or like so whenever you're communicating with people who don't sign, is it fine or do you have a hard time? So I was born in South Africa. I didn't grow up there, but I do have family that live there. And so the culture between the US and South Africa is completely different. So I remember whenever I visited home in South Africa and I was trying to have conversation with my family, they had strong accents and it was so hard for me to understand. Some people didn't realize that I was deaf and I had to tell them like, "Oh, yeah, I'm deaf." And so we really tried to communicate with each other, but for me and how I understand a person, it takes me a while of spending time with that person to learn their cadence and how they speak in order to understand them if I'm not using any type of sign language or other tools. And so sometimes whenever I would talk to my family, I would get frustrated and I'd ask them to write down on paper for me. But in South Africa, they have less resources for deaf, hard of hearing people. And it's very individualized. And so I'm thankful that I was raised here in the US and that we have access to resources and that there's an entire deaf community here and that we have laws set in place to protect us. I know that they're not always enforced, but there are laws that are set in place to protect us. And whenever I travel, there has been times when I traveled alone. I was in Europe for 2 weeks, and I think that was about a year and a half ago, but it was a great experience. And it was interesting to navigate, with limited accessibilities, but, I've relied on apps, gestures, writing, like I've emphasized. And I also, had to change, some of the ways that I kind of communicated to try to match another country's customs. Lily says, I have one more question in the chat. So you mentioned that you work with interpreters to help improve their medical skills. So could you tell us more about that experience? Yeah, sure. So I work for a university called St. Catherine's University, and they have a big project supporting interpreters who want to pursue medical interpreting. And so my role with that project is community assessment. So I go in, I sit with the interpreter, and we'll do like mock scenarios, and I'll show them just different health terminologies or find out what they know and what they don't know. And we discuss that, for example, like cardiology, related to the heart. And we'd practice that together, and the interpreter would practice signing that topic. and I provide feedback on their signs and their use of terminology and how they can translate that and explain the actual concept in ASL to make sure that the patient understands clearly what exactly it is that their situation is. And so there's people from all different backgrounds. Whenever you have deaf people, you have people that maybe are very oral, very well understand English, all the way to people who are very pure ASL and very gestural and very, you know, facial expressions. So we work together and are able to match all different modalities. So people who are not good signers, not in the medical field, how can we help make things easier for access with deaf people in medicine and medical, whether you know ASL or not? How do we make things easier for deaf people? And Tabi says, I just want to make sure I'm understanding that right. So those who don't sign, what are ways that they can help make things easier to communicate? Okay. So the first thing that comes to mind is continue that motivation to learn ASL. You can research on different apps, or you can research different apps and download them and just study them for 5 minutes, a day. There's one app called ASL Bloom. That's a great resource. There's Livango, and that's something that you could just do to continue practicing and improving your skills or just simply gaining simple skills. There's also one website called Atomic Hands, and that focuses on signs related to STEM. I think that was one of my former biology professors founded that site and developed it specifically for scientific terminology. So that's a little separate than just regular ASL, but if you're interested in a visual and understanding how certain things work, that's a very good resource. So thank you for that question. All right, so it looks like Lily is saying it looks like time is running out. I want to thank our interpreter, Nakia. Thank you so much. And I'm just amazed with all of this. And if you haven't used Conversify, I'm going to put my email in this chat. You can email us anytime. And Natavi, would you like to put your email in the chat also? All right, so Conversify is really just to share language experiences. I'm sorry, the interpreter misunderstood. So lived language is just to share the language experience, and we are through the platform Conversify, which we help you become immersed with that language that you're interested in learning. So thank you all so much for joining, and I hope you all have a great night.